Assalamualaikum. Good day, sir. I am Armelina M. Masdal, third year college Bachelor of Science in Nursing. Today I will going to report about the COPD. So, COPD. COPD means chronic obstructive pulmonary disease. So let's focus for the learning objectives. First is define the chronic obstructive pulmonary disease or the COPD. The next is describe the pathophysiology, clinical manifestations, and findings of chronic obstructive pulmonary disease. And then next is describe the medical management and also the nursing management. So let's begin for the introductions. Chronic pulmonary disorders are a leading cause of morbidity and mortality in the United States. So the nurses' knowledge of palliative and end-of-life care is important for applicable patients. Patient and family education is an important nursing intervention to enhance self-management in patients with any chronic pulmonary disorder. In the United States, there are the large numbers of death with these diseases, which is the COPD. So as a nurse, you need to take an actions. To teach the patients for the self-management. So next, let's proceed to the definition. So chronic obstructive pulmonary disease, or the COPD. This is the disease state characterized by the airflow limitations that is not fully reversible. Sometimes referred to as a chronic airway obstructions or chronic obstructive lung disease. This COPD, it can cause the airflow blockage and also breathing problems. This COPD, it makes breathing difficult for the 16 million Americans who have this disease, which is the COPD. Then next is pathophysiology. Pathophysiology, people with COPD commonly become symptomatic during the middle adult years, and the incidence of disease increase with age. So as you can see at the picture, so you can see the symptoms of the chronic and the emphysema. So in chronic bronchitis, overweight and cyanotic, elevated hemoglobin, peripheral edema, bronchi, and wheezing. So in emphysema, you can see older and thin, severe dyspnea, quiet chest, X-ray, and hyperinflations with flattened diaphragms. So this chronic bronchitis, a disease of the airways, is defined as the presence of cough and sputum productions for at least 3 months in each of 2 consecutive years. So as you can see at the picture, this is the airway. So the healthy airway. So if there is a chronic bronchitis, there is an inflammation and excess mucus. And then emphysema is a pathologic term that describes an abnormal distensions of the air spaces beyond the terminal bronchioles and destructions of the walls of the alveoli. So at the picture, you can see the normal alveoli. So if there is an emphysema disease, so the alveoli is damaged. And then next is clinical manifestations. So clinical manifestations, although the natural history of COPD is variable, it is generally a progressive disease characterized by 3 primary symptoms: the chronic cough, sputum productions, and dyspnea. So chronic cough, this is the one of the primary symptoms of COPD. Because it can cause your lungs to produce the excess mucus so it can lead to the frequently coughing. And then next is sputum production. So there is a hyperstimulation of the goblet cells and mucus secreting gland leading to overproductions of sputum. So increasing sputum is the increasing of the mucus production and secretion. So because of the oversized mucus glands in their airways compared to the healthy people. And then dyspnea is usually progressive, persistent, and worsens with exercise. So dyspnea, because of the lungs, becomes damaged. Next is assessment and diagnostic findings. Pulmonary function studies are used to help confirm the diagnosis of COPD, determine disease severity, and monitor disease progressions. So first is the health history. So the nurse should obtain a true health history from patients with COPD. So first, for the assessment, you need to assess the health history and also the physical assessment of the patient. The next is spirometry. Spirometry is used to evaluate airflow obstruction, which is determined by the ratio of the FEV1 to forced vital capacity. So this FEV1, this is the amount of the air. You can force from the lungs in 1 second. So next is the adrenal gas. So these are arterial blood gas. So arterial blood gas, so in short, is to determine the acidity or the pH of the blood. The next is that chest X-ray. So chest X-ray may be obtained to exclude alternative diagnosis. So this X-ray exam is to help to support diagnosis of the COPD by producing an image to evaluate the symptoms of the shortness of breath or the chronic cough. So next, let's put to the medical management. So medical management. So their therapeutic strategies for the patients with COPD including promoting smoking cessations as appropriate, prescribing medications that typically include the bronchodilators and may include corticosteroids, managing exacerbations, and providing supplemental oxygen therapy as indicated. So bronchodilators are key for symptom management in stable COPD. So means these bronchodilators, which is to alleviate the airflow limitations and also the bronchial obstructions. And corticosteroids, although inhaled and systemic corticosteroids may improve the symptoms of COPD, they do not slow the decline in lung functions. So, in short, corticosteroids, this is to improve the lung functions and also the health status. And then nursing management. So nursing management of patients with COPD should be incorporated with teaching and improving the respiratory status of the patient. So this nursing management aimed at improving the quality of the life of the patients. So that's all for my topic. Thank you.